right, well, my guest today is Dr. Drew Timmermans, owner of the medical practice Regenerative Performance, located in Gilbert, Arizona, just outside of Phoenix. Welcome to the podcast, Drew.
Thanks for having me on, Scott.
Yeah, as we were saying offline, it's been a long time coming. Since I started this, you were one of the earlier folks I discovered, and really enjoyed your content because it's been really informative. It gets into some forward-thinking or newer technologies, or not technologies, but methodologies and treatments to help, or some that are maybe even reborn to some extent. But it's always great to learn new ways that you don't see at the macro sometimes.
Mm-hmm.
So great to have you on.
Appreciate it.
So before we kind of get into the practice and what you do at Regenerative Performance, brief background on yourself, how you got into medicine and kind of maybe got down this path of terms like regenerative medicine and integrative medicine.
Yeah. So born and raised in Canada, in Southwestern Ontario. So
I thought I noticed an accent.
I'm a little proud every time somebody says that, because I've now been in the States for going on 8 years. And
okay.
So it's nice that I don't say A as much anymore, but I've still maintained my accent that comes out every now and then. So born and raised there. I did my undergraduate studies in kinesiology, so human movement sciences, at the University of Western Ontario. And probably to kind of give the backstory on how I got into medicine and then digressed over into where I am now with naturopathic medicine. So in high school, in our careers and civics class, when we were exploring different options, the idea of being a physician kind of came across my table. And my parents had actually given me some like old school anatomy textbooks, not textbooks, but books when I was a kid.
Yeah.
Kind of like those, the see-through ones where every time you flip the page, like a new layer is kind of shown on the page.
Yep. Yeah.
And it was the human body, right? So first page was the skin, and then you flip that, and then you got to the muscles, and then you flip that in the organs. And so I'd always been fascinated with the human body. And so in high school, I thought, I want to go down the path of medicine in order to help people. And my nanny, my grandma, had passed away from ovarian cancer as I was entering high school. And so, that was kind of a pivotal thing for me. That was my first exposure really to, how does medicine affect me as a human and the lives around me. And so I think that was also kind of influential in my career path for medicine. But in high school and even in undergrad, I didn't know about naturopathic medicine. It just was never on my radar, because it's just not talked about much, right?
Right.
In Canada, a doctor is an MD and that's it, right? And in the States here, we have MDs and DOs. So like when, majority of the population, you say I'm a physician, they'll think, oh, MD or DO. Except in some areas where naturopathic medicine is a little bit more accepted and widespread. But so I set my path on that, wrote my MCAT, scored well, had a great GPA. I was a varsity track and field athlete. And so, I had a really great resume, but I went and applied for med school and had some interviews, and I didn't get accepted. And and I was actually just on recording a podcast yesterday, and we got deep into this discussion, but I realized recently that was the universe telling me that this is not your path, because I knew people that were in my cohort that applied with me and got accepted, and I knew their MCAT scores because I wrote the MCAT with them, and I knew their GPA because we were friends and openly talked about it, and they got accepted and I didn't.
Right.
And so that was a really big blow to me initially, because, I wanted to be a cardiothoracic surgeon. Like that's what I was really passionate about at the time. And so I thought, okay, I'll take a year off. I will, boost up my extracurriculars, because maybe I didn't do enough volunteer work. Maybe I got to go do stuff in a hospital, whatever. And so I started working as a personal trainer. at Good Life, which is one of the largest, is the largest gym chain across Canada. And during that time, I started to explore more the holistic or alternative route of health, just because it's what I could help my clients with, right? I could talk to them about nutrition. I could research supplements to see what might help them with their pain or, whatever else that they were going through.
Right.
And I really got exposed to this. And then I would be getting excited when, patient or clients would come back and they'd say, oh, I had my checkup with my doctor and I went from 2 blood pressure medications to 1. Or I was on 3 different cholesterol type drugs and now I'm down to 2. Like, they were getting off medications because the exercise and nutrition stuff we were doing. And I was pumped. Like, those were like the best appointments to my clients, because I was helping them get off medications. And so one of my clients recognized that, and she goes, hey, you should really look into naturopathic medicine. I'm like, what is this? Right. So I go and that night I look online and research it. And instantly it was like, so there's 6 tenets of naturopathic medicine. And in a gist, it's, doing no harm, treating the root cause, treating the whole person, using the healing power of nature, which also includes like our body's ability to heal. And I read those things and it resonated with what my internal locus was for medicine and health. And it confirmed what I believed about health without anybody putting the idea in my mind, right? I didn't have anybody saying, oh, you should look at health this way. No, it was like, this is what I personally believed about health. And holy crap, there's a place out there that's what they believe too. And instantly it was just like, I'm changing paths. Like, I don't want to be a surgeon anymore. I want to go down the naturopathic route because this resonates with me.
Yeah.
And then, so there's only 7 schools across the US and Canada. And so I did some research and looked into a few different ones, had some interviews, and flew out here to Arizona and was like, yeah, I'm not going back to Canada.
Sorry, Mom.
Sorry, Mom. I am now going to be in the hot sun all the time because it's much better than 6 months of winter.
Yeah, right.
So that was the path that took me down to naturopathic medicine. And once I got here out in Arizona and started school, I was kind of a little lost in what I wanted to do, because I didn't know what existed in the kind of sports medicine world. Because during my time as a personal trainer, I really started to also dive deep into the musculoskeletal medicine side of things, because a lot of my patients were in chronic pain and that type of stuff. And so I thought, okay, well, I don't really know what there is for sports medicine. And I was so naive at this time when I first started school. It's just like, there can't be anything in naturopathic medicine for sports medicine. But I was like, that's fine. Like, I'm going to, so I explored, I checked out the different clubs at school for gastro and cardio and oncology, just trying to like feel things out to see what I might kind of focus or specialize in. And kind of during all this time, backtracking a little bit, right before I came out to school, about 6 months before, I was in a car accident in Canada, and ended up herniating a disc. And so I had really, really bad low back pain that no one could ever really figure out. And the treatments I was doing were just palliative. I never had any cortisone injections or surgery, thankfully, but I was still just in chronic pain. And so when I finally discovered that, there are places that do sports medicine from a kind of more naturopathic standpoint, I went out to Florida to a conference that was heavily focused on that. And there's actually a conference mainly of MDs and DOs, but they were getting on kind of the fringe side of sports medicine with PRP and Prolotherapy and all these different injections that weren't covered by insurance. And so while I was out there, there was an MD. His name is Brad Fullerton. He's based out of Austin, Texas, who is probably like influential in my path. So he did an ultrasound examination on me for my low back pain, because I talked to him and told him it had been 2 to 3 years now, chronic low back pain. No one could figure it out. So he, evaluated me. He's like, you have some tears in your lower trapezius muscle, and you've got a strain of your iliolumbar ligaments. And 2 days later, at the end of the conference, he treated me with PRP, and 3 months later, I was pain-free.
Really?
And my mind was blown. I was like, that is exactly what I want to do for the rest of my career, was help people who are in chronic pain and use things that, they might not be covered by insurance, but it helps people.
Yeah.
And so that's kind of what then set me down this whole path towards regenerative medicine.
That's really cool. And like chronic pain, you mentioned that, and you hear chronic inflammation too, is like, that's like the biggest issue, it seems, as I'm learning, going through this process of issue in America, and really in, I guess, first world countries even, where there's the low grade constant issue that just lowers the quality of life.
Mm-hmm.
That is just not really talked about, or it's kind of like you were even alluding to, is like kind of blown off. It's like you have to just accept hitching your step now for the rest of your life, because that just is what it is. That's just how I'm made, or that's the circumstance. So I'm just like almost a victim of circumstance.
Right. And I think part of it is because the allopathic model is not really set up for that type of medicine, that type of healthcare, right? It's very set up to be, you either have this disease or you don't have this disease. There's no this kind of gray area. Yeah. And one of the things that I've talked about a lot on social media is that, like, healthcare and health is not a cliff. It's not like, and mind you, yes, there are instances in life that can look like a cliff, right? You're in a car accident and you go immediately from healthy, happy to disabling chronic pain. But in the chronic, disease place, it's not a cliff. It's this hill, right? And it's you start at a state of health, and you slowly go down, and at some point you start to notice symptoms, but you keep going down. But if you don't fit the criteria that the allopathic model has defined as disease, then a lot of and it's part of this is insurance. The issue is insurance. Insurance isn't going to cover if you kind of have a disease. You either do or you don't.
Yeah, it's binary.
You're approved for treatment, or you're not going to get approved for a treatment, right?
Right.
And so I think that's why naturopathic medicine is starting to grow, why functional medicine is starting to explode, because there are all these Americans who are suffering, and the current system for chronic disease has parts of it that are broken, that doesn't recognize these kind of dysfunctional states as opposed to a disease state.
Yeah. And so you kind of mentioned a couple of terms, mentioned at the beginning, integrative, and that seems to be a newer term. And even the name of your group is regenerative medicine. Mm-hmm. Can you like kind of quickly define those terms a little bit?
Yeah. So, I'll define them kind of the way that I think of them, as opposed to a formal definition. But integrative medicine, the way that I think of that is, it is using all available tools in order to accomplish the job at hand. And so one of the ways that I think of myself and other integrative practitioners or integrative physicians is that we're kind of like general contractors, right? We're not a plumber. We're not a, electrician. We're a general contractor that can kind of do and use different tools. And so when I need a medication for a patient, I'm going to write that prescription for that medication. If my patient needs a referral for surgery, I'm going to refer for surgery. If they don't need that medication or don't need that surgery, I'm going to use the other things that are still evidence-based, right? It's not, I'm just pulling things out of thin air and saying, oh, I think this will work. No, there's legitimate research behind this stuff. And it's saying, okay, well, you're not a good candidate for surgery at this point. So let's look at different supplements, herbs, regenerative injections, lifestyle stuff that we can implement to make your suffering less and hopefully get you to a place where you're not suffering at all.
Yeah.
And so it's using this blend of the old school traditional medicine of herbs and nutrients and sleep and exercise and that type of stuff, and blending it with what we have from conventional Western medicine, which is pharmaceuticals and surgery for the most part.
Yeah.
So that's integrative medicine. Regenerative medicine is generally how I think about it is I'm trying to help the body. I'm trying to help set up the body to heal itself. So the healing process, you have to have some form of regeneration in order to heal. And so the therapies that I'm doing, whether it's an injection, right? Most people, when they think of regenerative medicine, they think of regenerative injection therapies, things like prolotherapy, PRP, autologous stem cell therapy. But at the end of the day, there's also a lot of other things that can help the body to heal itself. So if somebody is in a chronic state of inflammation that's causing, let's say, knee osteoarthritis, there are non-surgical, non-injection things that we can do that can help to slow that down. And so that's kind of where I think about and how I think about regenerative medicine.
Okay. And so it's kind of assessing the baseline of a particular client or customer to see where they are and make sure that they're kind of operating optimally. Is that a fair way to say?
Yeah, in part. And then it's the regenerative medicine aspect is really focused on orthopedics. So it's focused on people who have joint pain, ligament pain, nerve pain, tendon pain, that type of stuff.
Okay.
Yeah.
And you mentioned a couple of the different approaches or modalities or treatments. One of them you used and got you down this path, which was the PRP and the Prolotherapy. So PRP is what? Platelet-rich plasma. So can you kind of explain kind of what that is and why someone might need that? If there's any other examples, like your own personal story.
Yeah. So I'll broadly talk about, so regenerative injections in general it's an approach to injections that what we are trying to do is actually get tissues to heal. The original regenerative injection, prolotherapy, actually originated in the 50s and the 60s by a few medical doctors who had suffered some chronic pain and chronic injuries that the surgeons of the time were just like, yeah, there's nothing you can do for it. And just suck it up. And they're like, no, I'm going to try these different things. And so from there developed this whole system of treating more than just inside the joint. Right. And so in the conventional system, if you have knee osteoarthritis, usually you're just going to go in, if you're getting cortisone injections, they're just going to put cortisone inside your knee joint and that's going to be it. They're not going to treat other things.
Right.
And so what developed from the 50s, 60s and onwards was this approach to look at the tendons, the ligaments that are surrounding the different joints and to assess those to see if they're contributing to pain and then treat those with initially they thought they were just sclerosing, which means to scar. So what they thought initially was, we're going to inject this irritating substance, which eventually was dextrose, and it's going to basically scar the tendon or the ligament. So that way the tendon or ligament is more stable and therefore less painful. Since, then we've discovered that there is some mild sclerosis that happens, but most of the time we're not actually scarring anything on the inside. We're actually helping to stimulate cells to produce collagen, and collagen is what makes up our tendons and ligaments and cartilage and that type of stuff. And so we're helping to kind of, I don't usually like saying regrow, but in essence, we are kind of helping to insert more of these collagen fibers into damaged tissues that is going to help them to be stronger. And when they're stronger, they're less painful. And so that's kind of the ultimate goal of all of the regenerative injections, whether it's prolotherapy, whether it's PRP, or even stem cell therapy. So yeah, go ahead.
So is it kind of using, is it external or internal substance, like your own personal chemistry, and then kind of reinserting it into your body to enable your body to do what it kind of naturally does or accelerate that?
Yeah. So with prolotherapy, it's dextrose, which is a sugar molecule. And so we take that from a vial. So like we get that from a pharmacy. But when we look at PRP, platelet-rich plasma, and then stem cell therapy, which comes from either the bone marrow or your adipose tissue. Both of those they come from the same person. So when I had PRP done on me, it was my blood that then went in a centrifuge, spun it. They extracted out the portion that is really rich in platelets. Platelets are these cell fragments that contain growth factors and cytokines. And when they come into contact with damaged tissue or they're activated, they release all of these growth factors and cytokines to heal different tissues. So that's actually, platelets are very involved in when we injure ourselves. So if we roll an ankle, our platelets are going to help orchestrate the healing response that we're going to get by calling in stem cells and stimulating the fibroblasts, which are the cells that make collagen. Also, when we get a cut, fibroblasts are going to be one of the first responders on the scene. Platelets are going to be one of the first responders on the scene in order to secrete their growth factors to help wound healing. So these platelets are really great at helping to heal different things. And so, back in the early 2000s, when Alan Mishra first kind of came across this for orthopedics, that's what the idea is. Let's take these growth factors and let's put them back into an area that's not healing well. And voila, things started to heal better.
Very cool. It's amazing how you're kind of using the natural occurrence of your body to heal and then just kind of amplifying it or a little bit.
Redirecting it.
Yeah.
Basically is how I kind of think about it, is we're taking something from one area of the body and we're redirecting it to a new area of the body that the body has kind of forgotten about, right? Because if you've had low back pain for 5 years, for the most part, your immune system, which is heavily involved in healing, is kind of just forgotten about that part to heal. And so we are just redirecting and kind of poking and saying, hey, body, you forgot to do something here. Let's help you and let's start a new healing response.
Got it. Very cool. That's pretty fascinating.
It is.
I've heard you on some of your recent posts on social media, which again, by the way, tons of great content there, is peptides. So that is very new to me. That it's about as far as I know in depth, but other than watching some videos. But can you expound on peptides, the use of those, and the value?
Yeah. So peptides are a class of molecules that are going to fall within a certain number of amino acids. So an amino acid is the most basic building block of proteins. And so we start with a single amino acid. And then once you hit a few amino acids, you can then call it a peptide. And then, so a peptide will just kind of be a long string of amino acids. And then at some point, when that gets large enough and the peptides start to fold on themselves, then we get what's called a protein. And so a peptide is not necessarily new and unique in the healthcare space, and because we have peptides that float through us all the time. It's just in the last kind of 5 to 6 years, these peptides that are taken from our body can be really, really beneficial for healing, and they've kind of hit more mainstream. So all of the peptides that I use in clinical practice and that a lot of other doctors will use are actually all naturally occurring in our own body, which makes them really, really fascinating, because they are not going to have some of the side effects that are commonly seen with pharmaceutical drugs, right? Because the way that pharmaceutical drugs are made is they're made to be very, very, very targeted at a specific thing that the researchers have determined to be, crucially important. So an example is cholesterol drugs like statins are going to specifically get at one enzyme, which is called HMG-CoA reductase, which is going to stop the production of cholesterol. So they've designed this molecule to interact with that one thing very, very specifically. But because of that, and it does it so strongly, there can sometimes be side effects that happen. Not always, and some drugs are worse than others, but that is unfortunately, it's a catch-22. It does a really great thing, but it might have some side effects.
Yeah.
The peptides have a kind of more broader and more gentler action than our pharmaceuticals. And so, for example, if we're going to start somebody on a peptide like BPC 157, we may see, improvements in their joint pain. It may just take 4 to 6 weeks for them to start to notice that, because it's a little bit slower acting, because it's not as direct and specific as something like ibuprofen, right?
Right.
Everybody's got joint pain knows you take ibuprofen, usually within 20, 30 minutes, you're feeling better, right?
Right.
It doesn't last long term, but it has a very strong acute effect. These peptides, though, they take longer, but because of our body's great ability, we have these peptides already in us, so they obviously serve really important functions, is we can actually get full resolution of symptoms sometimes with these peptides. I've had many patients come to me who have had chronic joint pain, and we start them on peptides like BPC 157 or thymosin beta 4, and 3 months later, they're 90 to 100% pain free. We stop the peptides and the pain doesn't return. And so we can actually get some true healing and regeneration with these peptides, which I think is absolutely, absolutely phenomenal.
Yeah. Yeah. Especially like you were saying, it's naturally occurring in your body. So your body's not going to reject it per se, or, some potential unintended consequence of some of the other medications like an ibuprofen that, over systemic use, could start wearing on other things like your kidneys and whatnot.
Liver,
I mean, that's significant consumption, but nonetheless.
Yep.
Okay. The other area that I found fascinating that you had mentioned, it was probably in the last week or two, was the talking about medications. The unintended consequence at times can be also the nutrient deficiency, on how, because of what it's doing to help, it could wear on other aspects of your body. But I thought that was really a fascinating piece. Maybe you can expound on that a little bit.
Yeah. So something that, I'm doing with every new patient that I have, is I'm taking a look at their medications, and I'm trying to assess if any of their symptoms might be due to a depletion of a specific nutrient, whether that's a vitamin, a mineral, or another type of compound like omega-3s. We're trying to see if their symptoms correlate with that. So a great example that we can use is proton pump inhibitors. So something like omeprazole. Because those proton pump inhibitors decrease stomach acid, you can become depleted in certain nutrients that require a very acidic stomach to be absorbed. So the main ones are going to be iron, zinc, and magnesium. And so patients over time can get really fatigued while taking proton pump inhibitors. And it could be due to an iron deficiency, could be due to magnesium deficiency. Zinc deficiency usually doesn't cause a lot of fatigue, but that can cause issues with the immune system. So people will get sick more often if they're zinc deficient. Night blindness can occur, right, where we have a reduction in the ability to see at night.
Wow.
That can start to happen with a zinc deficiency. And then we can also see some issues with testosterone production and hormone production and that type of stuff. And so we're always trying to figure out, hey, is this not necessarily a side effect of the medication, but just an effect of the medication.
Right.
And so, and a lot of doctors aren't talking about this with their patients. Now, there are some that are more well-known. And so anybody who might have rheumatoid arthritis or something, they take methotrexate, their doctors are prescribing folic acid, which is B9, alongside it, because it's a very well-known depletion of a drug like methotrexate. But metformin, for example, depletes vitamin B12, and it depletes vitamin B9. And both of those, when you have depletions in those, you can get peripheral neuropathy. Well, one of the complications of diabetes and metformin use is peripheral neuropathy. And so sometimes it's difficult to tease out, is the peripheral neuropathy of this diabetic patient due to their disease? Is it due to the blood sugar issues that, clog up the smaller blood vessels, which then result in less blood flow to the nerves, which cause peripheral neuropathy? Or is this a folic acid or a B12 deficiency from the medication? And so it's sometimes hard to piece that out. But yeah, so usually when I'm working with patients, we're trying to replete those. If I'm starting a patient on a medication that I know, usually has a pretty strong nutrient depletion effect, we're supplementing that alongside the medication just so we can reduce the chances of them having long-term issues because of that.
Okay. Wow. Yeah. I mean, it's something that doesn't seem to be talked about. And it's not, it's just an observation as a layperson, but a lot of those things are not being looked at, that it's very siloed and you're addressing the one thing without understanding the corollary effects to other aspects of your body, or even if you do, like as the patient, you may not even consider it, like, oh, I'm feeling a little lethargic. Oh, maybe I didn't sleep well, and you kind of blow it off, but then it continues on. Anyway, they're just
and I think too, the with the allopathic model, I think it's phenomenal and terrible at the same time that there are so strong of specialties and subspecialties where doctors are in these silos, right? You are an interventional cardiologist, or you are a gastroenterologist, or you can even get very specific in the surgical world, where an orthopedic surgeon might only do shoulders.
Right.
And that is, I find that is absolutely phenomenal, because in my opinion, if somebody has something that is very, very extreme, it's very life or death, it could alter their world. You want to be with the specialist who dedicates their life to what you have and can help you. And that's going to be your best odds of, getting out of that sticky situation that you're in.
Right. Yeah.
But in the chronic disease space, chronic pain world, that it does a little bit of a disservice to patients, because it now becomes, well, that's not in my specialty and I don't know about it, because rightfully so. I don't think that every interventional cardiologist needs to go learn about gastro to know, the difference and how to work that up, or know about orthopedics, because they need to be very focused and specialized.
Right.
But then when someone comes in and they've got a long-standing chronic problem, it now becomes they're working with 4 or 5 different doctors, because each of them have a specialty. And then there's not really a lot of crosstalk, because doctors don't have time to, round table every single patient that comes in that's seeing other doctors. Right.
Yeah.
And so, and again, it goes back to what we were talking about earlier. I think that's why naturopathic, functional, integrative medicine is exploding right now, because people are wanting someone to address their gut pain with their joint pain, with their heart issues, because they're not actively dying. They don't need a surgeon to, put them on a table and to save their life, but they need a doctor who can spend more than 15 minutes with them to hear about all their different issues and try to make connections. Especially, for example, when you start seeing, subclinical deficiencies, in something like magnesium or vitamin B6 or vitamin C. Those vitamins and minerals affect so many areas of the body. And so you have to take a whole body approach in that sense, because you can't just look at, oh, well, this magnesium is causing some issues with muscle cramping, and then just ignore everything else, because it's all integrated.
Yeah. Yeah. It's all interwoven. And that's been for me a recent discovery of like going consistently, getting the blood work up, and we change. Like, we're walking chemistry sets at the end of the day.
Mm-hmm.
And we know that generally every 7 years your body has a big transformation, but then there's so many different external factors that seem to influence the environment where you live, your home,
Exactly.
activities, stress, exercise, or lack thereof.
Yep.
So it's definitely a fascinating thing. And we kind of mentioned it at the beginning. It's so many things become siloed or binary rather than like a continuum, right?
Mm-hmm.
Of healthcare or health, wellness, whatever that is defined as. It's very bucketized, and it's either or conversations, it seems.
Mm-hmm.
Um, so as somebody who's kind of in the naturopathic and looking at things a little differently than, the standard medical approach, are there things that you're looking at or observing right now or investigating that is kind of, I'll say, on the horizon, so to speak, or looking at things a little differently?
I mean, I think a lot of what I do is already that, right? The
Standard practice
regenerative
for you?
injections, the peptides, those types of things. A lot of the MDs across the country don't know about peptides. There's probably only a few thousand practitioners across the various specialties, and types of physicians and practitioners that, actively utilize peptides with their patients and things like that. And so those are the big things. I'm always trying to figure out new ways to help patients with chronic pain. And so sometimes that's, going back to the basics, with stuff. And so the last kind of 6 months, I've really been diving in deeper onto the nutritional side of helping patients to heal, not necessarily with, what diet to eat or whatever, but more like what vitamins and minerals become depleted in patients who are in chronic pain, and what strategies can we use to improve that, and sometimes even not have to do injections, and other times to use it in conjunction with injections and things like that. Because at the end of the day, if someone is subclinically deficient in vitamin C, for example, they're going to have a harder time building more collagen. And again, the allopathic model looks at like, oh, you can't be deficient unless you have scurvy, like you're not deficient in vitamin C. And that's grossly incorrect, right? There is this state of disease, which is scurvy. And then they think that if you don't have scurvy, you are healthy. And there's this huge gray box in between where a lot of people are going to be deficient in vitamin C. And so so that's really what I've been looking into kind of the last 6 months, is how can I, do lower level therapeutic things, right? It's not high tier, it's not stem cell therapy, it's not cool peptides, just like what basic things can I do with people so that way they are better set up to heal either on their own, or when we come in with an injection, they're going to have a better response. Maybe just from starting some different vitamins and minerals, they could get 20% better outcome from their PRP treatment. And so now the money that they're spending, because these things aren't covered by insurance, the money that they're spending is going further for them. And that's kind of what excites me and what I'm really diving into lately.
Yeah. Great. Yeah. Sounds like just kind of equipping people that can empower them to do, improve their own wellness. That, because sometimes it does seem, whether it's, medical or personal development or whatever, you don't know what you don't know. So it's kind of hard to get past that first step, or get to that first step,
Yeah.
Of medicine, or
Yep.
getting back to healthiness.
Yeah.
So what is
And
a
the nice thing too with that, real quick, the nice thing
Yeah.
too with that is because things like magnesium, the B vitamins, vitamin C, all that stuff affects almost every cell in the body. It's, if I'm doing this stuff for their orthopedic issues, right, their joint pain, usually they're reporting improvements in other areas of their life. And that that makes me happy, right? If I can improve somebody's sex life or somebody's mental emotional status, as I did some things for their joint pain that are just going to affect the whole body, that's a win-win for me.
Yeah, absolutely. I mean, you mentioned, even the the mindset piece of it. If you have chronic pain, that's going to wear on your mind, which is going to
Mm-hmm.
spiral a lot of other things emotionally, and how you even respond in life, whether it's work or your family, and
Yeah.
that interconnectedness of, just like you said, the holistic aspect of the body, the interplay.
Mm-hmm. Yeah.
So real super tactical, what would be a practical recommendation to those listening that who are learning about this for the first time, or what's a step for them to take that you would suggest?
Yeah. So usually the things that I preach the most about from a generalized standpoint is going to be sleep, nutrition, hydration, and exercise. Sometimes I throw in like social connections or meditation, mindfulness, which I think is important, but I think the 4 basic pillars really need to be sleep, nutrition, hydration, and exercise. So on the sleep front, most people should be waking up 5 days out of the week refreshed. Most people wake up 1 to 2 days out of the week refreshed, and that's usually a Saturday, Sunday, because they don't have to set an alarm and they can go and actually sleep for an extended period of time. And a lot of my patients, when they first start working with me, they don't wake refreshed any days of the week. Every day of the week is a struggle to get out of bed.
Yeah.
And so because sleep is so important to our body's ability to heal itself, because that's when we do most of our healing is while we sleep, it's a huge emphasis and focus for people. So to get better sleep, usually what I tell patients, the biggest needle movers that I call them is going to be light exposure. And so we are exposed to way too much light after sunset, and that is triggering our brain and telling our brain that it's time to be awake. When in reality, we need to signal the body that, hey, it is time to start sleeping. And so usually after sunset, what I tell people is to turn off at least half the lights in your home. And if you can turn off more, turn off more. That's number one, because that's just going to reduce the amount of light that's hitting your eyes, which is going to reduce that signal to produce cortisol and produce more melatonin. And then the other is to use blue light blocking technology. That's going to be on your phone, on your computer, and also in the form of glasses. So on Amazon, you can get blue light blocking glasses for $20-$30. And all my patients who have issues with sleeping, we get them to wear them as soon as the sun goes down. And
Really?
Yeah. And most patients will notice, so like right now in Arizona, the sun's setting around 7:30. If I put those on at 7:30, by 8:30, I'm like, I am ready for bed. Like, it's not even a question of like, okay, I'm going to choose to go to bed at 8:30. It's like, I am now tired because my brain's actually getting the signal that it's nighttime. And so we then get to, have better sleep, but it's not a forced sleep. It's I'm actually tired. So now I'm going to go to bed a little bit earlier than tossing and turning until 10, 11 o'clock, for example.
Yeah, because you touch on something that I've been looking at in the last month or so, where you can get it on your phone, but also the glasses as well, on the blue light. And I'm somebody who, that was the premise of this podcast was sleep issues, and it's still kind of a roller coaster. So I may be investing in some blue light glasses.
I would highly, highly recommend it. Yeah. So that's the sleep side. Hydration is super simple. It's whatever your body weight is, divide that in half, and that's how many ounces of water someone should be drinking minimum on a daily basis. And so, I weigh 180 pounds. And so every day my goal is to get 90 ounces of water per day.
Wow.
Now, climate is going to adjust that a little bit, right? So here in Arizona, where it's drier and it's hotter, usually I'm going to add probably anywhere between 15 to 20 ounces onto my water. So I'm usually shooting for 100 to 110 ounces. And that's if I'm not working out, because obviously if I go work out, I'm going to sweat more. And so we need to be repleting that as well. And usually I think we're doing half a liter per hour or 250 to 500, depending, mLs per hour of exercise. And so when most people, you talk to them, they're maybe getting 30 to 50 ounces of water per day. And, most people are at least 200 pounds, right, for guys. And so most people are just not getting enough water into their system. And now the kidneys are decently good at trying to adjust for that and reducing urine output, but it's long-term strategy. That's not the approach that we want to take, because you can still be subclinically dehydrated. Your cells can be dehydrated. Your fascia can be dehydrated. Your joints can be slightly dehydrated, and all that can contribute to the perception of pain. And so focusing on water. On the nutrition front, I'm not really, everybody has a diet that they're going to respond best to. I personally respond really, really well to a paleo-like diet where it's super high protein and meat content and, really low starch content. And I do well. I feel phenomenal when I eat like that. I have patients where they feel god awful when they eat like that, right? And they need more of a vegetarian type of diet. And so, but the one consistent thing I found is that we need to eat what nature gave us, right?
You need it all. It just depends on how much.
Yeah. And it's removing the stuff that is literally made in a factory, right? Where they're taking chemicals and they're adding things together and blending things together to make Pop-Tarts or to make, Doritos chips. Like those, there's no Doritos farm that you can go pick a bag of Doritos, right? But there's, so it's just getting back to not eating crap food, processed food, and eating things that nature and the earth is giving us.
Right.
And then figuring out what flavor of that you want to be, right? Whether you want to go carnivore, whether you want to go vegan, whether you want to go paleo, whether you want to go whatever else there is, pagan. Like there's so many varieties and flavors, and everyone's got to figure that out. But it's just getting back to just eating real, actual food that contains nutrients, not this nutrient depleted stuff that we're getting out of factories.
Yeah. Yeah. And I think, again, we talk about degrees. It's like a better, best kind of approach. And they're all viable. Like you said, you got to figure out what works best for you. And, I've also heard from a nutritional standpoint, it's always good to even, like intermittent fasting and changing the diet up a little bit to kind of awaken your system.
Yeah.
To some extent. I don't know the science behind it, but I've always heard and read a lot of things.
Yeah. No. And I am a really big fan of intermittent fasting, and we use that a lot with my patients who, either they have a metabolic condition or they've got a cardiovascular condition or even an orthopedic condition. Because when we do those extended periods of fasting, whether that's true intermittent fasting where we're doing, a 36-hour or 72-hour water only fast, or if we're doing what's called time restricted feeding, which is where, it's like the 16-8, where you fast for 16 hours and you only eat in an 8-hour window.
Right.
Doing that stuff really starts to drop inflammation. And part of it is, it's a little bit twofold. The one part is it's helping your body to deal with the inflammation that it has, because its energy is not being expended on digesting food. So we have a set amount of kind of capacity for the work our body can do. And that's why when we sleep, we heal the most, because our body is not focused on moving, on digesting and all that other stuff that mental processing that we have to do during the day. And so when we give our gut some rest, the body can then take that energy and it can use it for other things. And one of the things it can use it for is, dealing with chronic injuries and chronic inflammation and that type of stuff. The other layer to it is that people are usually eating very highly inflammatory foods because they've got chemicals in them. They've got different things that might be triggering their immune system. And so just a reduction in the insult on the body from all that crap is going to be helpful in dropping inflammation. And so usually a twofold thing that we see there with intermittent fasting.
Okay, great.
And then last is the movement, right? Is exercise. So most of the time, I would love if all of my patients and everybody, got in and did some form of, more intense exercise a few days a week, kind of got 30, 45 minutes, of whether it's HIIT or it's some longer distance stuff or it's some strength training. But at the end of the day, I just want people to do more, right? So if you're not exercising, just going for a 10-minute walk every single day is going to do way more than doing nothing, right? If you're already walking 6-7 days a week for 30 minutes, changing out one of those walks for some strength training to build some muscle mass, right? Strength training. And so our muscles are literally anti-inflammatory machines. When we exercise, our muscles produce what are called myokines, which is basically little signaling molecules that come from the muscle. And those are very anti-inflammatory to our body. And so when we exercise, we are literally, at the end of the day, helping to reduce overall systemic inflammation. Now, sometimes that's difficult because people might have chronic pain that stops them from doing certain exercises and things like that. And so that's where a lot of things need to be individualized, and what I will work with patients on, or I'll refer them to a really great strength coach that I have out here in Arizona, and he'll work with them on that. But at the end of the day, we need to get muscles moving more and get them activated and people to get stronger. And yeah, adding on a few pounds of muscle mass is probably going to be a very beneficial thing for most people.
That's an interesting detail. I had not heard the anti-inflammatory aspect of it.
Yeah. So one of the big ones is IL-6. So IL-6 is a cytokine that is produced in different areas of the body that can basically trigger other processes to happen. When IL-6 comes from our fat cells, it is a pro-inflammatory adipokine. And adipokine just means it's the signaling molecule from adipocytes, from fat cells. So IL-6 from adipose is pro-inflammatory. It causes inflammation. When IL-6 is made from muscles, it is anti-inflammatory. And so the same molecule is both inflammatory and anti-inflammatory. It just depends on where it comes from, because it's going to act in the local area that it's being secreted and have those different effects.
Wow.
And so that's where, we see this duality aspect of something like IL-6, but there's other things too that our muscles are going to create in the process of when we exercise that are anti-inflammatory.
That is fascinating. I'm going to have to dig more into that after this for sure. That is really cool. So we're definitely coming up on time and went a little bit over, but grateful for all the insights, man. I mean, it chock full of information. I could probably talk for another hour with you on all this, but I wanted to close out with a couple of personal questions. Yeah. So what are you reading right now?
Oh man. I'm partway through The Body Keeps the Score. Have you heard of it?
No, I've not.
So it's a really, really fascinating book on by an MD. He is a psychiatrist by training, and he deals a lot with patients with PTSD and trauma. And so probably about, I'd say 6 to 9 months ago, I really kind of hit a roadblock with a patient who was in chronic pain. And every time we would do our injections with him, he would relive the traumatic experience that resulted in this chronic pain. And it would be very, very troubling for him, because this accident that he had was over 50 years old.
Wow.
And so, The Body Keeps the Score has been on my reading list, and people have recommended it to me for literally like 4 years. And I never had the purpose to go sit down, because that's usually how most of my education, my personal learning occurs, is I have a patient that I've hit a roadblock with, or that I need to know more about. And so I dive into that so that I can help that one person, which will end up helping other people. But just with how much information there's out there, I would get so overwhelmed if I was just reading to read. So I'm usually very targeted.
Sure.
So anyway, so I went and got this book to try and really understand more how traumatic experiences can be stored in our body, in our connective tissue, and patients can have, chronic pain that is related to that event. And so that's the book that I'm slowly getting through right now, is The Body Keeps the Score.
That's awesome. Yeah, it's kind of similar topic, where I've had some conversations on the emotional aspect and the physical pain, like you're saying, and how a lot of bronchial based things can be emotionally driven. Mm-hmm. That for whatever reason, it seems like a lot of emotional strain and stress and anxiety ends up residing in your lungs. Anyway, that's a conversation for another time.
Fascinating.
So music or podcast? What are you listening to?
Podcast, definitely Peter Attia. Have you listened to his? Yeah.
I just got turned on to him. I had not listened yet, but.
Oh, it is. I mean, you can go back. He has so many great things in there. And what I really appreciate about his podcast is he explores the non-mainstream things in medicine, right? He's looking at fasting, he's looking at the ketogenic diet, but it's always from a very rigorous scientific approach. and based on research, and where there's not research and it's his clinical experience or clinical opinion, he's always forthcoming about that. And so it's not these other podcasts that people will go on and just spew a whole bunch of stuff that's, not really based on research. It's kind of their opinion, but they act like it's research. No, it is very clear cut. And then his show notes. So I subscribe for the monthly membership, which gives me access to his show notes. And so every single article that they discuss is linked. And so, like, from my standpoint, from, a clinician side of the equation, when he talks about something with, sleep and chronic pain or sleep and cognitive issues, like, I can go into his show notes and I can pull that paper and I can read it and I can digest it. So that way I can talk better with my patients about it, because I'm now educated on the primary research, and he just kind of opened the door and kind of gave access to that. And so, that, and then Gary V. I'm a big fan of Gary V. And so, and I actually haven't listened to Gary in probably, I don't know, 2 months or so, probably since this, the whole pandemic thing kind of started. But not just because I'm just focused on, building my practice and doing that stuff. And I'm in a heavy learning period right now. And so, but those are the two podcasts that I probably are the only ones that I would consistently listen to.
Okay. What is your go-to rest and recovery method?
Sleep, for sure. Sleep, and then cold exposure, I'd probably say, and nasal breathing. I'm going to use all three of those. So sleep is the given, but nasal breathing exercises post-exercise have been really, really powerful for me. So I've gotten pretty close with Brian McKenzie, who I'm sure you're aware of.
Yep.
And him and I have spent a lot of time talking about this stuff, and I incorporate a lot of breathing exercises with my patients, just because of how powerful it is. But I'm a very high sympathetic tone individual. And so because of that, I sometimes have a really hard time after an intense workout coming down from that workout, right? Getting back to a normal body temperature, normal status quo. And so the nasal breathing exercises afterwards have really, really helped me to down-regulate that sympathetic nervous system, allow the parasympathetic nervous system to show itself more, so I can be more cool, calm, and collected throughout the day after a really intense session. And then on the cold exposure, I'm not using that as a direct recovery method. So it's not like hopping in an ice bath, after a really hard workout to, decrease DOMS or anything like that, because I actually think that's detrimental to performance long-term. But using it on off days and away from exercise to help train the body to react better to stressors. And so again, it kind of goes back to this main theme of setting the body up to appropriately respond to a stimulus, right? The cold exposure and doing that in conjunction with nasal breathing, that can help people to respond better to a stressor, whether that stressor is exercise, whether that stressor is a divorce, whether that is just the common cold or the flu or anything else, right? Setting up that body is super important. And so that's probably my biggest ones.
Awesome. Yeah. The cold exposure, I've definitely been reluctant to do, but I'm working on my sleep.
I tell you, it's tough.
But I mean, like you said, it's got some good value to it. And, regardless of the training or, like you said, dealing with the stress, is like, it doesn't have to be an elongated time, but just do it. So at least one, you can develop some mental toughness and be able to respond more calmly or cleanly to a catalyst.
That's a good way to put it. Yeah.
Rather than like this big spike in the net.
And freaking out. And yeah.
So, well, Drew, again, grateful for the time. Glad we were able to connect, and, have a great day. Appreciate it.
Thanks, Scott. I appreciate it.